This brief video is for women and couples who are planning to start a family and are thinking about having a test called a reproductive carrier screen. A reproductive carrier screen is a test to determine whether you carry genes that could cause serious health problems in your child. The commonest of these conditions include cystic fibrosis, spinal muscular atrophy and Fragile X syndrome, but there are many more too. This video aims to give you information to help you make your choice. If one or more of these conditions, or indeed any other inherited genetic condition, is already known to be present in your family, then the testing process is very different. Carrier screening is for couples who don't have any known family history of inherited genetic conditions. The genes you would be tested for cause conditions that have their onset when a child is young and have a very serious impact on a child's health, quality of life, and how long they live for. Cystic fibrosis and spinal muscular atrophy are called recessive conditions. This means that both of a child's parents must carry the gene for the child to be affected. When both parents do carry the gene, there is a 1 in 4 chance of a child having the condition. Fragile X is different. Men have only one X chromosome, so if a woman carries a Fragile X gene, there's a 1 in 2 chance that a male child would be affected. However, female children also can be affected. Because these conditions are all uncommon, the most likely test result will be that you have a low chance of having a baby affected by one of these genetic conditions. Such a result doesn't guarantee that you'll have a healthy baby, and it doesn't mean that you shouldn't have testing once you're pregnant. It is possible that the test results might show that you or your partner carry a gene that increases the risk of having a baby with one of these genetic conditions. In that circumstance, you would need to discuss the options available to you. If both you and your partner carry a gene, then it's important to think about what you would do. There are 4 options available if both you and your partner carry a gene for one of these important conditions. One option is to consider IVF treatment with testing of the embryo. Another is to become pregnant and then have testing. This is possible, but it leaves very little time to act on the results if you are already pregnant. A third is to consider the use of donated eggs or sperm. Finally, some couples may choose not to become pregnant. So before you have the test, make sure that you've thought through these options and, if necessary, discuss them with your doctor. Receiving a test result that shows you carry one of these genes can be a shock, and you'll need support and counselling if this happens. These resources are available, but don't underestimate how finding out news like this might affect you. If the test shows that you do carry a genetic condition, this could potentially have implications for other members of your family. For that reason, before you have the test, it's important to think about how health information is shared in your family and how you might tell your family about any results that could affect them. All medical tests have limitations, and genetic testing is no different. For example, sometimes the testing doesn't work first time and a second sample will be required. In some cases, the test isn't able to identify an abnormality, even though an abnormality is present. This might be due to a gap in scientific knowledge, or perhaps an inability of the laboratory to identify certain types of changes in the genes. There can be other reasons too. In summary then, genetic testing can detect uncommon but important genes that have the potential to cause severe conditions in children. These tests are best done before you become pregnant. If you're planning to have the test, make sure you have thought about how the results will affect you, your partner and your family, and recognise that no test is perfect. Make sure you discuss anything that isn't clear to you with your doctor.